8234. Jamison Coyle alongside Billy Jaffe. Join now, special guest, Dr. Tony Giamberardino. Did I get that right? You said we could call you Dr. G, though, right? To make things really simple for this segment. Doctor, thank you so much for joining us. We talk about a lot of different cancers, a lot of different diseases throughout the day in these 2 days, but oral cancer is one that doesn't get a lot of attention like some of the other ones, correct?
Correct. It doesn't. However, it can be a very aggressive form of cancer, and treatment, it can be very disfiguring because there's a lot of surgery involved. It's because it is an aggressive cancer. So we really just are looking to try to raise awareness about that, get people to, be aware of changes in their mouth. If they notice something, or the dentist notice something, or hygienist, that they want to follow up and make sure that there's something that's not just a temporary thing. If it's there for more than 2 weeks, definitely get it checked.
What are some of those signs? What are some of the things you should be looking for?
There's either some growths, or swelling, or redness, some white spots. A lot of times it's a telltale sign that if you notice it in your mouth, sometimes it's due to trauma, and if it goes away within a week or two, that's fine. But if it lingers or is painful in any way, definitely need to get it checked out.
Now, this doesn't get an awful lot of awareness. However, you, the MDS, the Massachusetts Dental Society, Nesson, and the Red Sox have partnered with Shane Victorino, or he's the spokesman for the campaign, so you're getting awareness out that way. But recently, less than 2 months ago, this did get a lot of focus with the death of a 54-year-old phenomenal baseball player in Tony Gwynn, who died of oral cancer. And Doc, have you seen a surge in inquiries since then? Have you seen, or at least more information about it? Because when an icon like that dies so young because of it, that has to have an impact.
Absolutely. It really drives the point home about how serious oral cancer really can be. Not only is it disfiguring in treatment, and if you catch it early enough, but it can certainly kill you. There are 40,000 new cases every year diagnosed, and about 8,000 people a year die from oral cancer.
Do people, can you just explain, you put out some numbers there, though. People think, oh, that little dip or that little bit right there, it's not a big deal. Can you explain how deadly that can be? In many ways, it's much worse than even smoking tobacco. It's a concentrated toxins that get placed up against the tissue in the mouth, and it just creates changes very quickly, very rapidly. In the case of Tony Gwynn, was a lifetime user of chewing tobacco, and unfortunately came back to really haunt him.
Here with Dr. G, he is the president of the Massachusetts Dental Society, and the MDS also participating for the 3rd straight year in the Boston Marathon Jimmy Fund Walk coming up later next month. Tell us a little bit about that involvement.
We've got a team this year of almost 40 people who are participating. Have raised, I believe, almost $20,000. Have a goal of $50,000 that they're trying to raise. It's our Miles for Smiles team, and they do a great job.
What's the typical age, or is there a typical age of patients for oral cancer, or that you see an awful lot of?
Well, it tends to go with time, over time. But what we're finding too is with the prevalence of the HPV virus, there is a much higher likelihood of young people contracting oral cancer. So you can't just ignore it at any age. It's not just for older people, it can be young people as well, so it's very important.
Well, I know awareness is a big part of this stuff, but so is the fundraising and the gifts, and I know you're up here and you guys wanted to make a gift today as well.
Yeah, we do. We have a small check that's actually a big check.
Oh, big checks are fun.
Let me give you again, this is a check for $5,000 representing the nearly 5,000 members of the Mass Dental Society. Beautiful. So we're very happy to present this check to Jimmy Fund in hopes of gaining more knowledge about cancer and treating it.
Well, Dr. G, thank you
and
very much.
I want to also put out there, I brought my own personal check for $100 I'd like to put out and challenge the dentists, my colleagues all over New England, to try to step up and add to the total.
You cannot deny Dr. G.
No.
Anybody named Dr. G can. Thank you very much for both.
All right. Thank you.
Thank you.
Appreciate it.
Pleasure's all ours. Thank you very much.
Okay, great.
Dr. G, adding to that tote board, it's at $658,000 right now. You just saw the $5,000 gift from the MDS, courtesy of Dr. G and all of his members, plus his personal donation as well, and the challenge that he has issued to every dentist out there in New England. So, Dr. G, we appreciate the time. Right now, we're going to send it next door to our friends at